Hey, everybody. Welcome back to Lunch with Lincoln. I am Reed Galen, your host. Today, my guest is Dr. Charity Dean. Dr. Dean is head of the public health company. She was previously the number two health officer in the state of California, and previous to that, the county health officer for Santa Barbara. She was prominently featured in Michael Lewis's latest book called Premonition about the pandemic and its origins and how we all reacted to it last year. So, Doctor, thanks for joining me.
Pleasure to be with you, Reed. It's always fun to talk with you.
So Doc, we talked on our podcast, it might have been like 6-7 weeks ago. And during that conversation, we started talking about the Delta variant of COVID-19. And now I'm going to get this wrong, so correct me if my numbers are wrong, but you said that what concerned you most about Delta at the time was its virulence compared to previous strains. And that you were worried that if we once again, in your words, broke containment, that we would very likely end up where we are today. So and you right before we went on, you said that in human time, it's only 6 or 7 weeks, but in COVID time, it feels like a decade. So in that decade of COVID time, how have you seen things unfold?
Sure. Well, the only slight correction I'll make to that is it wasn't the virulence I was so worried about, because at the time we didn't know if it was going to be more virulent. In other words, does it make people sicker? Right. What I was super worried about was the infectiousness, or the R naught. So Delta variant spreads much faster and more efficiently than previous strains. So to your question about where we are, that is absolutely what has panned out. It's been frustrating to see how this is somewhat predictable, in that a virus that spreads faster and more efficiently, that's more fit, that has an R naught of 6 to 9 versus 2 to 3, is going to burn through populations. And from early July, when we knew this and we're looking at the numbers, and you don't need a complex modeling algorithm to figure out that an R naught of 6 to 9 is going to move super fast. Indeed, where we are today is we're seeing states burning up, and I'm very concerned about the children.
So just before we move on to additional questions, because I am not a scientist and I'm not good at math, can you explain what R naught means?
Sure. It reflects the number of people that one infectious person will infect. So if I have a virus and I live my life as normal, going shopping, going to school, having dinner parties, on average, how many people will I infect? And with the original COVID-19 virus, that number was somewhere between 2 and 3. When we do lockdowns, it drops the number to below 1. When the number drops below 1, the virus is going to burn out. Right. When the number is higher than 1, it's going to spread. So what's terrifying about the Delta variant is, with an R naught of 6 to 9, that means one person is going to infect 6 to 9 people, unless we take proactive measures right now to limit that.
So to that end, the last time we spoke, and you talk about, you mentioned this a lot in Lewis's book as well, is, what are the proactive measures? It seems to me that, as we talked about last time, that containment has been broken. And so this thing is out. What is it? Are we still in a proactive stance? Or are we reactive at this point?
Well, I think I would answer that by saying this feels very similar to me as the beginning of the pandemic. I hate the phrase "when COVID hit," as if it's some massive meteor flying out of the sky that no one could predict. The correct phrase is when the United States failed at containing COVID-19. Right. And I would say that's the correct phrase to use right now for Delta. When the United States failed to put containment measures in place for Delta ahead of these surges. We knew this was coming. We were about 4 weeks behind the UK in July. So we had a really clear picture of what was about to happen. And what's frustrating is that vaccination has been a huge success. Vaccination works really well preventing hospitalization and death. What's frustrating is that we know that fully vaccinated people can still get infected and spread the virus. So as far as preventing infections from spreading rapidly, we can't just look to vaccination as the single layer of defense. And yet in July, that's what we saw happening, that the United States basically said, oh, in locations, our goal is to increase vaccination, and was not looking at masking and social distancing and other measures that we adults can take. And the whole goal, our entire focus as a country right now needs to be protect the children, because the children can't get vaccinated. And in the 0 to 12 age range, who are too young to get vaccinated, we're going to see Delta burn through those populations at alarming rates. So even if the virus isn't more virulent, meaning it appears that the hospitalization rate for children who test positive is somewhere around 1%, might be higher. So people might say, oh, that's really low. And I would say to them,
unless it's your kid.
Not if it's your child. That's right. And so we are watching pediatric cases surge, and I'm very, very worried about the children.
So I want to come back to that. But before we talk about kids, look, I have, 2 kids who aren't old enough to be vaccinated. So I totally understand. What is different about Delta's behavior that's driving this surge?
Yeah, I think that's an important topic. The behavior of the virus, not that we're assigning a personality to the pathogen, but I kind of do. Every pathogen or every new variant behaves differently. What's different about the Delta variant is with prior variants, people were infectious about 1 day before they showed symptoms. Sometimes they didn't show symptoms. It appears to be with Delta that people may be infectious for longer than that, potentially up to 2 days before they show symptoms. Also, it appears that people have higher viral loads, which means not only are they infectious when they have no symptoms, but they are breathing out a lot of virus particles into the air. So those are some of the hypotheses that are behind why we think this virus is so much better at spreading. The bottom line on Delta behavior is it spreads faster and easier without any symptoms during that early infectious period, which means it's fully vaccinated, healthy, asymptomatic people like me walking around that may be driving the Delta surge.
Mm-hmm. Well, and to think about that, I mean, we have several friends here where we live fully vaccinated who picked it up. And it seems, and I could be wrong, this is obviously all anecdotal, it seems that more people we know now have gotten it than got it last year in the initial round, if that makes sense. Mm-hmm. Mm-hmm. And I guess, is that an anecdote that also has, a causal relation to its virality?
It could be. So let me rephrase that a little bit, because you're spot on in saying, look, I'm observing all of my friends who were fully vaccinated. They're getting Delta. Maybe they only have sniffles, or maybe they were instantly found to be positive. The concern in July, my concern, the biggest thing I was worried about was that the CDC had stopped tracking breakthrough cases, or people that were fully vaccinated that then got Delta. They had stopped tracking that on a national level in May. Mm-hmm. And that worried me deeply, because that meant we didn't know what percentage of fully vaccinated people are still able to get infected and then spread the virus. And anecdotally, I was hearing the same thing you were. All of us doctors talk behind the scenes. We text, we email, we call. Anecdotally, we were seeing a ton of breakthrough infections who were not severely ill, maybe had a mild fever, sore throat, but who were in fact infectious with Delta. And what we know now from studies that have come out over the last month is that being vaccinated is very protective against hospitalization and death. It will save your life. Being vaccinated is less protective against you spreading the virus. So we are going to see more and more of these breakthrough cases. Doesn't mean the vaccine doesn't work. What it means is we need to take measures right now to protect the children from getting infected from those of us who are vaccinated, but can still infect them.
So to that end, what would you tell, I hope most of the folks, if not all the folks watching us and listening to us right now, have gotten vaccinated. If you haven't, please, it's free, it's easy, it's out there. What would you tell those folks like me who have gotten both jabs? What advice do you have for us, or what admonition would you have for us right now?
Well, the first thing I would say is thank you for protecting our children. The single most important thing we can do right now to protect children who can't get vaccinated is all the adults need to get fully vaccinated. And the second thing I would say is vaccination is one single layer. Back to the metaphor of layers of Swiss cheese. You have a bunch of layers of cheese and they all have holes in them. Mm-hmm. The objective is to have so many layers of cheese that a marble cannot pass through them. Mm-hmm. Vaccination is only one layer, and we now know it's a layer that has holes in it. That vaccination does not fully protect you against infecting your children. So what I would say to people like you and I is, thank you for getting vaccinated, and now is the time for all of us who want to protect the children and those that are vulnerable to wear masks, limit our gatherings indoors, voluntarily put in place all the things that we know decreases the spread. Look, this is an airborne virus, straight up. This is airborne, which means we know what to do to decrease the spread. And what's frustrating is to see that here we are, very similar to where we were in March 2020. And yet I don't see governors and elected leadership understanding what is about to come. It's one thing to see ICUs full of adults. It's about to be another thing to see them full of children.
So let's switch to kids. You have kids, so do I, and I assume that. Look, we're seeing stories all over the country, regardless of whether or not it's those governors who are actively taking measures against masking or those who are trying to do the best. What is it? Why now? What is it about Delta, or is there something about Delta that is making children more susceptible to infection when they seem to be poor recipients of and vectors of the original version of COVID?
So I'll answer that in two separate parts. Your why now question is the best question. That's what everyone should be asking. But let's just talk about the math for a second with children. Sure. So there are around 50 million-ish school-age children in the United States. With an R naught of 6 to 9, this virus is going to burn through population super fast. The original COVID was 2 to 3. It still moved fast, but this one is way more efficient at spreading. Schools are reopening right now. And so we have a situation, and I want kids back in school. I'm a firm believer kids need to be back in school. I'm sending my kids back to school.
As am I.
Good. What's challenging is we now have a situation where kids are in close proximity. This is an airborne virus. It's spreading very, very rapidly. Kids under 12 can't get vaccinated. So even if the rate of hospitalization or, the percentage of kids that end up getting very sick from COVID, even if it's the same as it was before, in a numerator and denominator game, if the denominator is every child in the US who can get infected will, because the R naught is 6 to 9, the numerator is not 0, meaning we are going to see hospitals, pediatric beds and pediatric ICU beds fill up. And that is absolutely terrifying to me as a parent. And that's why I think the message for adults needs to be carefully consider your own actions, because our whole mission right now as a country should be to protect the children.
So we see, in places like Alabama and other places that, ICU beds are full. Let me ask you this. You're a doctor, right? Specific kind of doctor. You're not a pediatrician,
no.
Right? So, and there are only so many pediatricians. There are only so many children's hospitals. Children don't tend to be as sick as, they get sick, but because they're around other dirty kids, and, that's what happens. That's part of building our immune system.
Dirty kids are healthy kids. That's what I believe.
Dirty kids are healthy kids.
I let my sons
then my kids are bulletproof by definition then. So what happens if there's 50 million school-age kids in this country, 1% is 500,000, right? And assume that those cases, and I'm getting to a question, I promise. So let's say that there is a spike in certain places, higher dense population density, lower vax rates, whatever. Are the individual health systems, because I know we talk about we don't have a national health system in this country, right? We have thousands of different individual things. Is the current health system prepared for something like that? Is it prepared for 500,000 child or pediatric hospitalizations?
Absolutely not. And you're right to raise that point of the numbers game, because then the part to add on to the numbers game is kiddos aren't just in a hospital bed for one day. Right. They're there for a few days. So what we saw happen with the adults, let's rewind to April of 2020, right, is the exponential growth curve is massive. But remember, as the exponential growth curve starts to ramp up, those that are hospitalized stay in their hospital beds. So it's not just check in, check out of the hospital. They're in the hospital bed for a few days, maybe a few weeks. And so in the US, we only have just over 5,000, I think it's around 5,400 ICU beds for children. That's it. And those beds have to have pediatric intensivists taking care of them.
Right.
So what I'm very concerned about is that we are going to quickly max out the capacity we have for pediatricians, for beds in ICUs to take care of sick children. And like with any pandemic or surge, once you break your healthcare system, then people start dying of things like appendicitis, heart attacks, women die in childbirth because there are no hospital beds, there are no providers. And so that's absolutely what we saw happen in many states during the surges with adults, is providers had to make horrible choices of who gets a ventilator, who gets a bed, and people who could have been saved died.
So one thing, I promised I would not do math because I'm not good at it, but I'm good enough at percentages. So if there's 50 million school age kids, 1% of that is 500,000. 1% of that is 5,000, right? Am I right about that?
Right. But I would add one caveat that of those 50 million school age kiddos in the US, the good news is somewhere around 9 million of them have been vaccinated. Okay. And then we have to make an assumption for how many have been already infected with Delta and thus have some level of immunity. So when I'm doing dirty math on this, I say 50 million minus about 9 million vaccinated, let's say maybe another 10 million that have immunity because they were previously infected. So then I start working with a number of around 30 million that I think are probably vulnerable to Delta variant.
Right. But the point is that you're now talking hundreds, if not thousands of percentage of available assets to take care of those kids. And,
right.
And let me ask you this, Doc, as a doctor, as someone who, has been in a position where you understand in a hospital room, the difference between life and death, and as an ambulance is being called, how does a pediatric intensivist make a decision about one kid living and another kid dying?
My God, I hope we don't find out. We did with adults.
Right.
I have been in that situation many times, and it is a horrible decision to have to make for adults. I'm an internal medicine doc, and I pray to God that we are not about to find out what it's like for pediatricians to have to make that decision. But we very well might be, looking at the trajectory of Delta, looking at the low level of adults that are vaccinated, looking at the number of pediatric ICU beds we have. That's my biggest fear right now, is that horrible choices will have to be made. And I pray that we put things in place before we get to that point.
Well, and as you talked about whether or not it's an adult or a child who goes to the hospital, whether or not it's in the ICU, which is a very specific unit, obviously specific area within the hospital, or is sick, doesn't need, maybe intensive care, but needs a couple of days worth of oxygen or whatever the treatment might be. That has a cascading effect on a personal economy, right? Either you can't work, kid can't go to school, kid can't go to school, so you can't work, piling up hospital bills and all these other things. So this really has a sort of holistic potential, to be as bad, if not worse, than we saw last year. Now, let me ask you this. I think we're north now of 600,000 deaths writ large from COVID-19. Do you see a similar level of mortality among all patients this year from Delta amongst the unvaccinated as you did last year when there just was no vaccine?
Absolutely. The Delta variant is going to impact, with the same virulence, those who are unvaccinated. They're just as vulnerable. This virus is making them, just as sick in same numbers at, people in the ICU and deaths. The challenge is it moves faster. So there's more of them. And I want to answer, I didn't answer the question you asked before that I said I would. Your point is so important about the economy. Hey guys, hey everyone, if we care about preserving our economy, we need to implement measures right now, personally, the personal choices we make every day to prevent these infections, especially in children. Because your point's well taken. Even having a sick kid at home or a kid in the hospital, then parents can't work, then they have medical bills. And so preserving the economy means stopping these outbreaks and stopping the surge right now. It's not an either or, it's a yes and. And that was, when I was on your podcast we talked about the false choice between preserving the economy and stopping the outbreak.
Right.
Those are really one and the same. And
Right.
we're back there. This feels very similar to March 2020 to me. We're back there again, that if we want to preserve the economy and protect children, that individual humans need to make safe choices right now.
So, Doc, let me ask you a question. Now, obviously, we have a fairly, what I would call, clear political belief in how we see things. When you see governors, making choices, going after school districts about mask mandates, providing reactive treatments, this monoclonal business and all this, as opposed to pushing vaccines and pushing masks. I mean, how do you see that? I mean, we see it from a purely political perspective, which will have ultimately human, human outcomes, economic outcomes, educational outcomes. How do you see it?
I said before, and I still believe it's true, and this is how I feel, I don't fault politicians for not understanding microbiology. That's my job. That's the state health officer's job. That's the doctor's job. However, we've been in this now for a year and a half. Many people out there deserve honorary MDs or PhDs in epidemiology. So governors no longer get to say, we didn't understand the math in microbiology. And what's frustrating is a governor or a elected official limiting what an individual can do on the local level, limiting what a school district can do, limiting what a mayor can do, or a county board of supervisors, because controlling and containing Delta has to start at the local level. So in cities or school districts where it's burning up, they need to be able to implement the right protective measures at their locality right now.
Right.
If we don't do that, then we're back in the horrible situation of broad lockdowns. No one wants that again. So let's all take the targeted local aggressive measures that we need to take. And when governors prevent that, I don't know, that seems antithetical to our democracy, that, local rule and making local interventions and doing the things to protect your community and your school. Absolutely. Folks should be allowed to do that.
Well, and as you and I have talked about, with you're a huge fan of Winston Churchill, as are we. And, it's always, if you go out of your way to avoid the worst outcome and do everything you can to avoid that worst outcome, you will eventually achieve it, because that's just how the decision-making process works. And then ultimately, again, with something like, as you called it, a novel pathogen, right? The novel pathogen doesn't care about your primary election date, right? It doesn't.
That's right.
It has no designs other than finding more and more hosts to reproduce itself, right?
That's right. That's right. And, I'm obsessed with Winston Churchill. One of the reasons why I love him is he understood that people can handle the truth. Tell them the freaking truth, and then tell them, and here's the plan, and you all have a role to play, and everyone get on board. Here's what we're going to do. This is going to get really bad. It's going to be, deaths in this category or this category. But then he'd give them a plan and ask them all to participate. And that's what has been missing from the United States response. That, yeah, we have the CDC and other institutions that are mostly retrospective and academic. What we don't have is a battlefield commander saying, hey, everyone, this is going to get really bad. Let me just level with all of you. We're headed into a massive exponential growth of Delta. Children are going to die unless we take measures right now.
So let me ask you this. We know, unlike we were told last year, that, it will not magically disappear. Do you believe that we're likely to see a continuing rise in infections amongst all Americans and frankly around the world, and deaths? Are we on a climb here for the foreseeable future, or do you think that is there some math that says it gets to this one place and then it starts to taper off again because it's just run out of people to infect?
Sure. Well, this anyone watching might think this is a very depressing discussion. So let me just inject some sparkly hope in this. I think the hope is, thanks to vaccines, they are very good at preventing deaths and hospitalizations. So yes, we're going to continue to see exponential growth in cases and growth in deaths. Like Florida is a disaster right now. If you look at their number of daily deaths, looking at Georgia as well, we're going to continue to see that grow. I'd be lying if I told you the date that it will level off.
Right.
But we can make some assumptions based on what the humans are doing, that we are far from out of the woods, that this is going to go on, for the foreseeable future. The hope in all of it is, guess what? We have things we can do. Yeah. We know this is airborne. We know vaccines work really good against hospitalizations and death. They're a massive success. And so, yes, we're going to see exponential growth, but yes, there are measures we can put in place. And that's what the adults need to be doing right now. What's challenging is the rest of the world, in many cases, doesn't have access to the vaccines. So this pandemic is going to go on for the next 1 to 3 years. And until the whole world is vaccinated, we're going to continue to struggle with it. It's going to be a game of cat and mouse with new variants that arise.
1 to 3 years is a long time.
That's my prediction. Yeah. And the reason is that this virus mutates and spreads. Right. And the vaccines are very good, but we now know that immunity may be waning and that new variants arise. And there is clearly going to be a need for a booster. How many boosters or how far into the future? I don't have a crystal ball, so I can't answer that. But directionally, that's the direction we're headed, that this is far from over.
Let me ask this. When do you believe that kids under 12 might be eligible to be vaccinated?
I hope really soon. I think that is, as a parent, that's what I worry about is the younger children getting vaccinated. And I have a lot of faith in the rigorous evaluation of the FDA, but I would also say to those, if I had an opportunity, we're in a war. This is a crisis. Children are dying. Expediting that process and allowing parents to choose to have their kids vaccinated right now is super important, because it's a trade-off of risk, right? With anything, you say, what's the risk of hospitalization and death versus the risk of getting a vaccine or other interventions? And so right now, my hope is that young children very soon will be able to be vaccinated.
Now, I promised you I wouldn't ask too many overly scientific questions, but let me ask you one for like the layman. Is like 12 an arbitrary number? Because like, does the vaccine know that the human body is 12 versus 11? Because I like, my gut says that it doesn't.
It's funny you should ask. Younger children's bodies are not just smaller versions of a teenager's body. Let me rephrase that. Children are not just smaller versions of adults. There really are different biochemical and physiological ways their bodies function. So it really is important for a vaccine to do the studies and the safety testing in children's of different ages. Younger kids versus teenagers, their bodies are different, their immune systems are different. Right. Having said that, could one argue that the difference between 11 and 12 is an arbitrary cutoff? Yeah, one could argue that. I've got an 11-year-old, he's in the 99th percentile for height. So is he the size of a 12-year-old? Definitely. But going down the scale as kids get younger, that's why there's a need to do the safety studies for the vaccine in younger kiddos. They really are different than older kids.
All right. So last question before we let you go, put yourself back in your role as a county health officer. If you could wave that magic wand and put yourself back in that place, what would you be doing in your county?
I would be putting out the message of the truth of what we're seeing happen with children and adults hospitalized and deaths. And I would be transparently sharing with people exactly what I think is coming, at the risk of being wrong, right? I mean, Michael talked about this in the book, that the challenge with the CDC and government officials in general is they only want to speak publicly when they have certainty. That's a wrong way to run a pandemic. The public needs to hear what we think is coming and what we think we should do right now. And so my message would be, this is going to get bad. We need all the adults to put measures in place right now to protect children. And I would daily be hounding that message about not just vaccinations, but all the other things we can do to slow the spread.
Well, Doctor, I think that's right. And to everybody out there watching, as I said, if you haven't been vaccinated, please do so. If you got kids who can be vaccinated, please do so. It's hard to believe that once in a while we have to be reminded to be responsible adults, but sometimes we do, I guess. So, Doc, is there anything else you'd like to share with us before we let you get back to your weekend?
I have incredible hope. even though this is a colossal failure of the United States systems throughout the entire pandemic, I will never give up hope that our democracy can build system solutions that are capable of containing a virus like this. I think this is a huge lesson learned for the US and have committed my life to that end. And I know others feel the same way. So I think this is actually a reason to have hope, not to lose hope.
Well, amen to that. And to everybody, I want to again say thank you to Dr. Dean for her time today. Everybody out there, please have a happy, safe, healthy weekend. Do those things for your kids and your families that are going to keep everybody safe. Follow Dr. Dean and her company, the Public Health Company, on Twitter. They're doing some really interesting and innovative stuff to make sure that so many of these systems that do not work as they should are learning the techniques and the expertise they need to do those things. Remember, gang, you can always pick up the podcast. Just past 6 million downloads, so thank you. And Dr. Dean had a lot to do with that as well. And remember that LPTV will be back this fall. Everybody have a great weekend, and we will see you on Monday. Doctor, thank you.
Thank you.